Radiology and medical imaging have often been used interchangeably, but they are not the same. Today we're going to take a look at the radiology department as it expands or evolves into medical imaging throughout the hospital. What is to become of the radiologist and the radiographer as diagnostic imaging becomes the primary diagnostic tool throughout the hospital? Medical imaging requires new alliances and collaboration for healthcare professionals. It also requires both clinical and didactic knowledge expansion to utilize the new imaging modalities. We need to examine the role of the radiology department of the future, or the medical imaging department. While radiology and medical imaging are certainly closely related, they are not the same thing. Radiology is the science of X-rays and other high-energy radiation technologies for the diagnosis and treatment of different conditions and diseases. On the other hand, medical imaging technologies are visual representations of the inside of the human body, both anatomy and physiology. Medical imaging generates a unique interface between high-level technology and the patient, and has been described as a human technical science. Multi-method studies incorporating both qualitative and quantitative approaches may be useful to inform medical imaging professionals as to the diagnosis of disease and pathology. This information is then shared with the appropriate physician or healthcare provider. There was a time in the not-too-distant past when conventional X-ray images were the only means of visualizing the interior of the human body. We had 2D images and film screen technology. At this time, the radiographer had to do many positions to be able to look at different parts of the body that we easily see today on just a conventional CT scan. Many of the positions that you had to know in 1970 are no longer used or very rarely used in medical imaging today. On the right, we did have gamma camera for nuclear medicine, which allowed us to see physiology. And here you can see the uptake in a brain scan that goes along with the gamma camera. Obviously, times were different, and we even had to do what's called milking the generator and preparing our own radionuclides and using them for injection into the patients for the different types of studies. So again, we had scans in those days, but they were nuclear medicine scans. Since the early days of film screen, we've gone to computer or digital images. Computers have changed the practice of medicine dramatically, and especially with regard to medical imaging. The use of computers in radiology has changed the practice of radiology and medicine dramatically. No longer do you have to look through the old film file room to find images or prefetch them, because the film file room has been replaced by the RIS, Radiology Information System, and the PACS, Picture Archival and Communication System. The PACS is basically an electronic file room, and the RIS does the scheduling for the patient. The old X-rays have been replaced by digital images, and now images are available to physicians throughout the entire healthcare system at the touch of a button. Today we have, in addition to 2D, 3D, and 4D medical images. It was difficult to obtain and to read film screen images in the old days because all the anatomy was superimposed and you weren't able to post-process the images. Today we're able to do post-processing, and at the same time we can look at the images in cross-sectional anatomy instead of superimposition. It used to be that we only had X-ray and fluoroscopy in nuclear medicine. But today we have a number of imaging modalities that lets us view the anatomy and physiology almost any way that we choose. In 2022, we know that nearly 350,000 registered radiologic technologists are working in healthcare settings in the United States, according to the ASRT, American Society of Radiologic Technologists. And the medical imaging market has grown to over $38.5 billion in 2022. So let's see what medical imaging can add to radiology. We have microscopy, photography, graphics, 2D, 3D, 4D imaging. All kinds of different images are taken not only in radiology, but pathology, the morgue, and throughout the hospital. All these are part of medical imaging. So we can see that the radiology department is evolving to a much larger scope of providing medical images throughout the healthcare system. As medical imaging evolves and advances, there are advances in technology, visualization technology, and graphics workstations, which means the operators of this technology and graphic workstations have to expand their knowledge base and clinical skills to remain relevant, whether they're radiologist or radiographer. Today's imaging modalities are computer-based, and we have to acquire the images differently than we did with film screen. We have to store the images differently than we did with film screen, and we can process the images differently than we did with film screen. So as you can see, the old radiology department has basically gone by the wayside. In the old film screen radiology, whatever image you captured was the image you got. Today, we're taking images that provide us with information, and we can utilize that information in many different ways through pre-processing and post-processing of the information or data. The data can be transferred to many workstations, stored at the workstations, and manipulated separately at each one of these workstations to gather different aspects of information about the patient and the patient's condition. Digital images stored in the PACS or Picture Archival Communication System can be accessed and displayed at many different workstations simultaneously and utilized by a number of physicians simultaneously. Imaging improves medical decision-making drastically. In turn, it increases the chance of the patient's survival and a better healthcare outcome. Due to the massive amount of data and storage of data, we are also using artificial intelligence to help the radiologists and physicians that are looking at the medical images by pre-processing, sorting, and making suggestions to the physician to look at specifics for making a diagnosis. The basis of every study is the acquisition, and understanding how to acquire and create medical images is paramount for the radiographer and radiologist reading the images. There is an old axiom with computer engineers: garbage in, garbage out. You have to be able to acquire the correct information to get the correct answers. So with medical imaging, this means who's ever acquiring the image must understand the modality and the techniques and the positioning of the patients when acquiring the images. Even though we can do pre and post data processing, we cannot process data that is not there. So let's take a look at what the person acquiring the images needs to know about each of the modalities. First of all, we have different modalities that we utilize. We utilize magnetic resonance imaging, we use X-ray, CT, computed radiography, PET, positron emission tomography. We also use histology with the lab, ultrasound, and a number of other types of image capture. At a minimum, the operator should know the theory of the physics of the signal and its interaction with tissue and the image formation or reconstruction process. To acquire data or create an image, we have some sort of energy interacting with tissue, and we're going to record that interaction. The recording of that interaction produces data which we can calculate to make images. With that in mind, you have to have an understanding of the biological effects of the energy on the tissue that you are irradiating, and that is associated with the type of modality that you're using. When we expose the patient, we are exposing them with energy, so we want techniques that produce a high image quality with using the minimum amount of energy to get the data we need. The types of energies we normally use are, first of all, sound for ultrasound, and then we use the electronic magnetic spectrum, where we gather energies that range from infrared and X-ray to gamma radiation. The energy is basically a difference in frequency of the signal on the electromagnetic spectrum. The signal can either be ionizing or non-ionizing radiation. Digital images usually record anatomy and physiology or a combination of anatomy and physiology. The data acquired about anatomy and physiology is then interpreted into medical images to help in the diagnosis and treatment of patients. The physics of imaging, or medical imaging from physiology to information. The next important consideration is the principle of imaging to be used for obtaining the data. A basic example is magnetic resonance imaging uses radio signals to create energy and pulse sequences, whereas X-ray imaging uses ionizing radiation, and single photon emission computed tomography, SPECT, and PET uses emission of gamma rays resulting from the interaction of radiopharmaceutical substances with the target. Imaging instrumentation. The instrumentation used in collecting the data is one of the most important factors defining the image quality in terms of signal-to-noise ratio, resolution, and the ability to show diagnostic information. Also, when you're looking at the detectors, the response of the detectors, and the decay time of the signal, all of these things can create artifacts. The data acquisition methods used in imaging play an important role in image formation. This is positioning and technique. Optimized with the image instrumentation, the data collection methods become a decisive factor in determining the best temporal and spatial resolution of the image. Finally, we look at image processing and analysis. Imaging process and analysis methods are aimed at the enhancement of the diagnostic image to improve manual or a computer-assisted interpretation of the medical image. With image processing and analysis, we get our diagnostic image. We look at the characteristics, we measure the areas of interest, we follow up on the information that we have on the patient, and then we create a report. Now we'll take a look at the radiology technologist. What is a technologist? A technologist is a person who uses scientific knowledge to solve practical problems. Merriam-Webster, the dictionary, says, a person who has special knowledge and skill relating to a particular job, area of study, etc., is a technologist. A radiologic technologist is one who has a deep knowledge and skill sets in medical radiography. Medical radiography is an ancillary service. Ancillary services may be diagnostic, therapeutic, or custodial to take care of all patient needs and assist doctors in diagnosing and treating patients timely, efficiently, and effectively. A radiology service is an ancillary service that has a radiologist and radiographers to provide medical images. Radiographers work well as a team, and the profession-specific team is efficient. But when it comes to working alongside other healthcare professional groups, there seems to be territorial boundaries, and the different professions appear to guard their territory, their own department. It is also seen when diagnostic radiographers visit other departments within the hospital to get images. Radiographers need to try to be part of the hospital team and communicate with other healthcare workers that they interact with. This will eliminate the tribal mentality that exists in some healthcare organizations and leads to errors and tension in the hospital. This t-shirt of a radiologic technologist has some inscription on the back which is pertinent to what the attitudes of a radiologic technologist appear to be. Let's analyze these two images of radiologic technologists and see how you would judge them on their expertise. The technologist at the top seems to be awfully concerned about radiation protection. Of course, there's no fluoro in the room, and they'll be standing behind the panel in the control room. So is there a need to get all of this radiation protection gear on? The second technologist seems very wary of radiation as well, but is more into patient protection. Of course, if she collimated down to where she was supposed to, would the patient need to wear gonadal shielding and a thyroid collar? Obviously not. So you have to actually ask, what knowledge base and skill set do these technologists have, and do they need further training and knowledge? Even with film screen technology, I would say yes. And with film screen, if you screw up, you can throw it away and do a repeat. But with digital imaging, you have to know what you're doing. With medical imaging and the gathering of data, remember, we're using a computer, garbage in, garbage out, and you don't get the chance of repeating the exam if you don't even understand that the exam does not have the information that you need. Let's look at some basic types of medical imaging skills. Imaging technologists are responsible for handling both complex imaging equipment and patient care, meaning that they need a wide range of proficiencies prior to actually doing the examinations. Medical imaging technologists have multiple points of contact with patients, but most are during the examination period. They are responsible for positioning and instructing people throughout a procedure, as well as communicating the radiation safety protocols. Therefore, technologists need to be comfortable with the examination process to ensure the patient is being prepared to get a quality exam. Technologists also need hard skills in the technical operation and maintaining and calibrating of radiographic equipment. It is the part of any diagnostic imaging job that is the core. A seasoned professional may also instruct others on using new equipment or evaluating which technologies to use. Which seasoned professional would you choose? Often when I was doing clinical with my students, what I'd see is the quote-unquote good old tech says, that's the way you learned it in school, but this is the way we really do it. Yeah, that's the way you really do it 30 years ago. So are you helping the student at all? All patients are different. And as a technologist, you need to be able to not only have a good in-depth knowledge of human anatomy and physiology, but how it applies to your patient and the exam that you are trying to perform. The radiologic technologist works one-on-one with the patient and must have empathy with the patient and be able to communicate with all types of patients. This includes having cultural sensitivity for different backgrounds and also sensitivity for patients that are suffering and in pain. Being able to communicate with these patients is crucial to getting your job done. There are a number of imaging modalities, many of which require a certification. A certification is from a non-government entity, and it demonstrates that the operator has the minimum knowledge base and clinical skills to operate the equipment. Here we can see the different types of medical imaging devices commonly used for radiology, ultrasound, pathology, endoscopy, and ophthalmology. Digital medical imaging is used throughout the hospital and in a number of different departments. These departments use the medical images to help diagnose and treat patients. Medical imaging is usually associated with radiology, ultrasound, and nuclear medicine, but there are many more different areas of the hospital that utilize digital medical images. The common denominator for all medical imaging modalities that are considered digital is that they utilize energy to interact with tissue to either record anatomy or physiology and create visual representations of the anatomy and the physiology. Let's take a look at the evolution of diagnostic imaging. In the past, it used to be simply anatomic, where we'd use plain X-ray films, CT, MRI, and ultrasound. As the modalities increased and computerization became more common, we went to functional imaging, such as angiography, Doppler ultrasound, nuclear medicine, MRI, and PET, positron emission tomography. As the technology evolved, we were able to do hybrid imaging, or basically superimposing or fusing anatomy and physiology into the image. Currently, we are also incorporating molecular imaging into diagnostic imaging. As you can see, what we started with was a simple 2D plane image, and today we're using very complex types of imaging modalities and contrast medias to be able to see all the way down to the atomic level on a human body for looking at physiology, and we're also able to see well the anatomy. So let's take a look at some of these imaging modalities, from PET-CT to SPECT-CT, spectroscopy, targeted ultrasound, and optical imaging. All different ways of taking information and creating images. Using computers, we can do wonderful things with pre-processing and post-processing of the information. Here we see a 4D image, which is a 3D image in motion of a PET showing the liver and the abdomen. This PET scan is a representation of molecular imaging or functional molecular imaging. It has high sensitivity and fast imaging times, but the spatial resolution is low. Let's see how we created this 4D motion image. And you'll note that the other modalities like MRI, CT, ultrasound, and SPECT can also do 4D imaging. 4D imaging is just motion and time. We begin by capturing the energy and recording its location on a matrix. If we just look at the 2D image, that will give us a cross-sectional anatomy image of the abdomen. If we use the Cartesian coordinate system and plot a three-dimensional matrix over a period of time, we're able to show motion and make an image. This image shows the motion of the radio tracer as it's being uptaken by the body, and it targets the tumor area. The radionuclide injected is an FDG, or fluorodeoxyglucose, basically sugar, and energy. As we know, cancer is known as a sugar eater, and what happens with FDG, it is picked up by the tumor cells more rapidly so that we can see where the tumors are and image them and reconstruct the images. The collected data is imaged over a period of time so that we get an idea of the tumor itself and its physiology. This is how we can do 4D medical imaging for PET. By targeting the tumor with the different types of modalities, whether it's CT, positron emission, tomography, and all, and mapping the energies using the Cartesian coordinate system, we're able to get an accurate placement and mapping of the tumor itself. So we start with a 2D image, and then we create 3D images over a period of time, which in the end gives us a motion picture or a 4D image of the data that has been collected. So here we're taking a look at a 2D CT scan which shows us the anatomy, and then we hybrid image or fuse the image into a PET CT scan which shows us the anatomy and physiology, and then by taking images and correcting for the metabolic activity and the tumor volume, we can actually see a movie of the treatment imaging area. So as you can see, the tumor does move, and what we need to do in oncology or radiation therapy is to treat the area of the tumor or target the tumor. As it's moving, this allows us to target it in its entirety and not miss areas. Once we have an indication that there may be some sort of tumor or abnormality, we can actually target that area using different modalities and do different things and actually watch the tumor as it grows, or conversely, as we're treating it, as it shrinks. So you can see what oncology does with radiation planning and how to treat tumors. So let's take a look at the basic computerization module or model of how we are using computers in basic medical imaging. The primary function for the computer data is acquiring the data, processing the data, and then visualizing the data and creating a diagnostic report. In the processing phase, what we can do is pre-process or clean up the image. Then we can do segmentation, looking at the different areas of the image, detection, finding the area of analysis, doing the analyzing with the data, and then we finally do a diagnosis. Because these are computerized digital images and they're utilized on a network, we can see all of the processes simultaneously anywhere on the network once the basic processing of the image is done. You'll note that in the beginning with film screen radiography, we had 2D images, and a big drawback or critical drawback of diagnostic medical imaging using the 2D dimensional images is that you're not allowed to manipulate or change the image in any way. What you see is what you get. Whereas when you use digital imaging, you can be creative and use the data that has been gathered to create all sorts of images to analyze the patient's pathology. It is important for the operator to understand this entire process and the physics of the process so they can use the appropriate techniques in acquiring the medical imaging. Without the proper data, you cannot create the images that have been requested. With the proper data or information, we're able to post-process the image. Post-processing techniques refer to interventions applied to diagnostic medical images after the image has been acquired from the patient. Post-processing techniques are usually done using an advanced diagnostic medical imaging program and they provide the radiologist with the information that is not available by just looking at the original images. With the need for developing or printing of films gone, the workflow process for acquiring and viewing medical imaging has improved. But most of the time spent now is actually in analysis and reconfiguration of the data as opposed to looking at a static 2D X-ray image. Because of the tremendous amount of images and data and different areas of interest, we're using artificial intelligence to pare the data down and create a set of images for the radiologist to be able to interpret. AI will become part of the radiologist's daily practice, helping clinicians improve efficiency and diagnostic capacity. AI has the potential to sift through a huge quantity of imaging data in seconds, assisting radiologists by helping to prioritize workloads, work lists, and diagnosis. Digital imaging and the acquisition of images now requires a greater amount of knowledge and clinical skill levels as compared to the old film screen 2D imaging. Unfortunately, because of the rapid growth of computers and medical imaging, the basic radiologic technology schools that give out their certification or primary certification for the ARRT do not have the ability or the time to cover all these subjects for the students. Therefore, the students need to get continuing education and keep continually upgrading their education as the field progresses. Of course, this also means they have to upgrade their clinical patient skills and clinical modality acquisition skills with the new knowledge that they've acquired. It is important radiographers are more knowledgeable and adequately prepared for a rapidly changing future. To ensure that they are prepared, however, it is essential for the profession to adopt an appropriate vision, formulate an achievable strategy, and promote a culture of professional practice which can respond adequately to the problems facing its continued existence.